y'all. Welcome back to Made It to Medicine with Vix. That's me, and I'm a third-year medical student at the University of Illinois College of Medicine, and I come to you weekly with videos about my pre-med term med school life, a little bit of everything in between. I am so late on this recap video, so I'm gonna start with OBGYN, and then I'm gonna go back and let y'all know how family medicine was. So OBGYN was so different than family, whereas each week we had something different that we were focusing on. So OB-GYN is obstetrics and gynecology, and coming in I was just thinking babies and probably pelvic exams, speculum exams, nothing more than that. But I'm gonna get into all of that and all of the good experiences and different experiences that I had on the rotation. Before we do that, do me a favor, hit the like button, the subscribe button, and turn your notifications on so you don't miss a beat. All right, let's get into the meat and potatoes. Also, I am on campus because I have consults today for my pediatrics rotation, so don't mind this background. It's definitely different. It's giving Harry Potter. Let me show y'all what the room looks like. All right, so for my site, I was at UIH Hospital, and we were oversaturated with students. About 3 times the amount of students that they normally get were at the hospital because one of our sites, Masonic, they closed to us, and then I think last minute another site closed. So UIH, since we go here, they had to take on all of the extra students, and I just happened to be one of those extras. And so that meant that my experience got truncated. It got shortened. I was supposed to be working 4 to 5 days every week. Some weeks I did not work that just because it was an influx of students. So I started off with labor and delivery and those shifts, depending on which time of day you are. So if you come in for the morning shift, it is 7 a.m. to 6:30 p.m. So that's 11 and a half hours. If you work the night shift, it is 6:30 p.m. to 7 a.m. So that's 12 and a half hours. The extra half hour definitely hurts. You feel it when you're on set shift. So I started with the day shift, and I was just like, oh my gosh, to me, this is the bread and butter of OB-GYN. And like literally I hear OB-GYN, I think babies, I think labor and delivery, I think someone giving birth to a child. And I didn't know what impact or what aspect I'll be able to assist in on that. But I was thrown in there on the first birth. So there are 3 stages of delivery. Seeing that I took that exam a few weeks ago, I'm like, what are they? So I believe it's like the contractions and like the dilation between 0 to 5 centimeters, I believe. So that should be like passive labor. And then active labor is once you're fully dilated, and then stage 3 should be like actually giving birth. So the longest stage is probably the pre-labor stage, when you feel those contractions, but your cervix is not dilated enough to pass a fetus, or now at this point a baby, through. And so I've got to go in the room once it's turned into active labor, and the contractions are now like within 1 and 2 minutes apart. And I was supposed to like hold the mom's legs up, and I believe that's the McRobertson position. I'll insert a picture on the screen, helping to open up the pelvis so that the head can come through the vaginal canal. And it was a lot. The very first patient I had tore, which most of the patients we had, they have some type of perineal tear, and she was laboring. It was fast, but there were like slight complications to the point where we had to take the patient to the OR and stitch her up. And by we, I mean them, because I just watched. And so that was interesting because there was a lot of blood loss, and with a lot of blood loss, you're concerned about hemorrhage. But I will say something that stuck with me from orientation was be mindful of the things that you're saying, be mindful of the faces that you're making. Just really try to be there for the family, because you may not remember these people years down the line throughout your career. You may not remember them, but they can remember something harmful or hurtful or joyful that you've said that makes their experience truly their experience. And a good point of this was one of my patients, at the end, after she'd given birth, she literally said to me, thank you so much for being here with me. You made this worth it. I let her squeeze my hand because she did a natural birth, no epidural. And she was like, I know I was difficult and I was going to cave and get the epidural, but I really want to do this naturally. And thank you for not judging me. And I'm like, girl, this your show. I'm just here to help support you, okay? Like, it's not really about me at all. And I'm happy that I was able to make this a positive experience for you. So that was great. Like, literally the hours sucked. suck for labor and delivery, but it was honestly one of my most favorite parts of the rotation. So then moving on to week 2, I was in GYN-onc. So that was gynecology and oncological services. Monday, Wednesday, I was in the OR. Tuesday, Thursday, I was in the clinic. And so I was able to do a pelvic exam under anesthesia. Of course, all of this is with the patient's consent. An endometrial biopsy. I saw a cystoscopy, which is when you're going in and cystoscopy, I believe, is the bladder. Yeah, looking at the bladder. Also did cytology, which was going in, looking at the cervix and going in a little bit further. Let's see. This week to me was very draining. It was very sad. UIH primarily serves Black and brown communities, and so a lot of the patients were Black and brown. And to be in the room with them and even like giving a cancer diagnosis or talking about the treatment processes of how this is gonna go, especially to younger women who are trying to have babies, and you know, if you have uterine, cervical, endometrial, ovarian, all these cancers, like they decrease your rate of being able to conceive a child. So that was a little bit hard on my heart, and I just feel like that entire week I was just sad. Something that I didn't know, outside of clinic hours, we also did hospital medicine. So this is when I found out that OBGYN is not just like, I don't know, clinic and surgeries or clinic and delivering babies, because we were actually in the hospital and talking to patients' families of those who have like sepsis or essentially at the end of their lives. And something that I know about myself is that I prefer more like acute care, or I don't really know another way to say this other than I don't like really sick patients. Sickness is not really my thing, so hospital medicine is not for me. I prefer clinic, you know, where it's like management, wellness visits, physical exams, birth control, or, you know, pelvic exams, giving shots, you know, like from the MAs or the nurses giving the shots. Those type of visits are more for me, but when the patient is sick, because I'm so invested in people that I'm serving, like it makes me sad. It weighs on my psyche, and I know that week was very, very hard for me. But after that, I asked how I performed with my resident, and she gave me some great feedback, saying that I was always willing to, you know, do things to make the load lighter for the team. So like when you take the patient, when the patient is going from pre-op to the OR as a medical student, you need to be transporting with anesthesia. And then once you switch them from one bed to the OR bed, you take the bed out, you sit it outside of the OR, you go and get warm blankets for the patient, put them on them, and then once they go into anesthesia, after you've tucked them in, you remove some of those blankets so that we can actually perform the surgery, prop their legs up if that's what's needed to be done. Whenever someone asks for something, either give it to them or make sure you're staying out of the way. Don't break the sterile field, which is everything that is blue in the OR. You do not touch that if you are not sterile, because that is a way to get yelled at. Like, so please don't do that. When the patient wakes up, go and get them more warm blankets, stay with them, ride with anesthesia and your resident to post-op. You know, like those little things really make a difference, just to show that like I'm taking initiative, not taking too long to scrub in, asking if there's something I could do, or like just being engaged throughout the surgery. So that part was really cool. I really still love the OR. I see like the lure that it has on me. It's very intriguing for sure. But week 3 was my favorite part. Well, one of my favorite parts is the clinic. I love being in the clinic. So I worked in the clinic, I believe it was supposed to be 4 days that week, wound up being 3 because I didn't have patients on Monday, which was crazy. But I got to do a lot on my own. I also got to do like some speculum exams, some pelvic exams, and I worked with the clerkship director. At the end of the week, she gave me great feedback. I did a whole video on that already. So that was cool. A bright spot from that week was I had a patient. Whatever their concern was, that's irrelevant. But as I'm going in, I'm introducing myself. And as I was about to leave out, I was like, okay, I'm going to come back in with the doctor and I'm going to discuss my plan with the doctor, and we'll come back in together and we'll see you. She was like, you know, when you came in, I literally said, oh my gosh, my doctor is Black and it's Black History Month. And I just love that for me. And I was like, well, you know, I'm a student right now. She was like, but you going to be a Black doctor. And I was like, you're right. I am going to be one. I'm going to be one real soon. This is what I mean when I say that representation matters. Like, there's no real way, or like no other way to put it. Her saying that unprompted, like there is no script. I'm not telling her what to say, how to behave, and all these things. And she was just so comfortable with me. And to say that, and yes, during Black History, it just made me have all of the feels. And I was just like so excited that even when the hours get long, when things go a little bit array, or like I am not on said schedule that I saw myself initially being on, when I heard the comments like that, I'm like, whoa, representation matters not just to me, but to other people as well. Loved it wholeheartedly. Week 4, I was back on labor and delivery. I was on nights. It was kind of hard shifting that schedule because I still went to sleep at the same time, still woke up like 8 o'clock in the morning, and I tried to take a nap before going into my shift. Did not get to take one. I was struggling to stay awake. I believe that first night though, it was very, very busy. We didn't slow down until around like 3 o'clock in the morning. That's when I was like, oh my gosh, I am tired. But we're gonna get through this. We're gonna do it. By the time I got to day 2, which again I only had 2 days and 2 nights for labor and delivery instead of 4, which I actually would have preferred 4, but for my body's sake, it was good because my feet were aching, my back was hurting. Yeah, I didn't get to ever deliver a baby. The one time I was gonna be able to help deliver the baby and deliver the placenta, the patient liked me so much. She said, can you please come back and hold my legs up because I like the way you do it. And in my mind, I was like, oh, I really wanted to help deliver your baby. But outwardly, I'm just like, wow, I'm positively contributing to the team. And like my team sees that I'm doing this. And beyond all the evaluations, like this mom is wanting me to be by her side while she's giving birth to her first child. So that was like, had me speechless. I was very sad though that I couldn't deliver a baby because again, coming in, that's what I'm thinking about when I hear OB-GYN. I'm like, babies, babies, babies. But seeing that I made a lasting positive impact was also great. Let's see, what else? Week 5 was on Urogyn, and for Urogyn, that was really cool. Also, never knew that there were like subspecialties of gynec and Urogyn in OB-GYN. I'm sure there are probably more that we just didn't get exposed to. But Urogyn was cool because I was in the clinic. They wound up not having me do a OR day, but me being the person that I am, I still was like, hey, can I come in when y'all in the OR because I really want to see this. So clinic times were very cool. A lot of it is checking for, sending patients to PT for prolapse to strengthen those pelvic muscles. And let's see, what else? A case that I did have was a paravaginal prolapse where like during the speculum exam, the speculum literally could not go inside because the vagina was on the outside, had prolapsed to the outside of the body, which was something I'd never seen before, the resident had never seen before, and the attending wound up putting a pessary in, which was a device to hold the vagina in place. And this was, it should like decrease some of the symptoms of like constipation or urinating on oneself. The attending was very, very kind. Like when you hear certain things about various specialties, sometimes people say that OB-GYNs are really mean. When I tell you, for the most part, all of my attendings were very nice and willing to teach me, which was comforting because as a student, like no one likes a mean or a hostile working environment, and I didn't have that. So I was very, very happy and grateful to be in that situation. By the time I got to Wednesday, I got to go to the OR, and it was like a cystoscopy, or we were supposed to have a labioplasty, but that patient had an asthma exacerbation, so we didn't get to see that one. And I believe I got to scrub in and do a pelvic exam and a speculum exam for those as well, so that was cool. And then when I got to week 6, I was in the OBED for the whole week, which is, think emergency department, but just for pregnant people. So there was a lot of gastroenteritis, which is nausea, vomiting, diarrhea. So basically food poisoning. And hypertension management, preeclampsia, or patients coming in because they feel like their cervix are dilated and they're about to give birth. More patients who actually did give birth. Some miscarriages, which was very sad, or a suspicion of miscarriage, abdominal pain, abnormal uterine bleeding, like all the things that I seen in my orientation, I actually saw in the ED, which I had lots of autonomy there. I got to see patients on my own, then go back in the room with the attending of the resident. I got to work on my patient presentation as well as coming up with an assessment and plan. I properly diagnosed, or like one of my plans or assessment was that a patient had preeclampsia. The attending was asking me all of the parameters to properly diagnose a patient with preeclampsia. I didn't know them exactly, so she had me to read an ACOG bulletin, which was cool. And let me see, what else was it? For the most part, I like to say I loved OB-GYN. Like, I loved it a lot. I'm still trying to figure out if it's something that I want to do because of the lifestyle. Several people on the rotation said if there's anything else that you love, do it instead of OB-GYN. And I'm just like, if you're in this field and you're telling me that, I don't know, maybe I should take heed. But right now, just weighing out the pros and the cons of, is it worth it or is it not worth it? I'm not sure just yet, but I really, really did enjoy this rotation. I knew that it was going to be a sleeper rotation for me, something that could completely come in and make me fall in love with it, and it did. Like everything made me fall in love except gynec, because that was just completely too sad for me. But other than that, I was like, oh my gosh, I love this, love this, love this. All in all, rotations, they're definitely different because you have to find time to study outside of the hospital. When you're tired, you still gotta say like, okay, if I told myself I'm gonna do 10 practice questions today, I gotta do these 10 practice questions. For me, if that looks like trying to do them on the train ride when I'm going into the hospital, on the train ride when I'm coming home from the hospital, or getting up early before my shift, or staying up late after the shift, whatever it is, you have to make those sacrifices and like stick with it. I did not finish all my questions on UWorld for going into OB/GYN. Was kind of sad about that. I think I had about like 40 to 50 questions left over, which is like, did my best. And me and my friend did a lot of questions on UWise, which is an OB/GYN specific platform, and a lot of those questions were actually repeated on the exam. Some questions from the practice MBMEs were also repeated on the actual exam. On my day in the life for the week of the shelf exam, I did talk about this and how I doubted myself when I got to the test. I changed a lot of answers. I'm working on that confidence because I gotta stop doing that. My score should have been way higher than what it was. If you didn't see that reel that I posted, I passed. Like, shout out to Big GOD for holding me down when I don't be trusting in myself. He be instilling something within me to still pass these exams, which has really boosted my confidence. I've never passed exams at this rate during my preclinical years. So I'm really like, no matter what nobody else says, I belong, I deserve to be here. And it's just amazing. It's really a good feeling to be in this time, this space, and this place. So that is my recap on OB/GYN. Yeah, it's amazing. And oh yeah, I had a conversation with one of the residents about representation and like being a minority in medicine, and how it's not just important for patients to see themselves in you, but for you to see attendings that look like you. So if you are an underrepresented minority, please keep going, because like, we need you, they need you, and honestly, you need to see somebody that looks like you as well. So all right, I will catch y'all in the next video. Bye.